Hi, and welcome to Spoonful of Strength. I'm Rachel, and I live with multiple sclerosis, type 1 diabetes, and a few other diagnoses that keep life interesting.
And I'm Tina. I am a fibromyalgia warrior with chronic back issues and a proud stage 4 cancer survivor. We're sisters, and together we're here to support, inspire, and connect. So if you're new here, the spoon theory explains how we navigate life with limited energy or spoons.
And we're thrilled to share that we've been ranked number 30 on FeedSpot's Top 100 Chronic Illness podcast list. So grab a spoon and let's dig into stories, tips, and a whole lot of strength.
Welcome to this week's episode of Spoonful of Strength. Rachel and I are going to be talking about who is really in charge of your medical care. Important topic that seems to be discussed quite a bit. And then after that, our spoonie joining us is Claire from the UK, and she is going to be sharing her journey with she has two different types of migraines. So she's going to talk about migraines and her migraine disorder. And it's going to be another fantastic episode. What is one thing that you felt you really struggled with this week, and how did you maneuver through it?
I think the thing that I've struggled with the most this week is, and maybe more than this week, but of just struggling with the amount of things I've got going on and the heaviness of another surgery. It'll be my third surgery in a year, and really struggling with the weight of not only the type 1 diabetes and the MS, but the asthma, the muscle condition that I have, and trying to keep my mental health in check, and just the weight of every day not knowing how I'm going to feel and what is going to creep in. I've had a new symptom with my hands shake, and I've got spasms really bad in my right hand. And so it's just like when you have a new symptom that lasts more than just a day, it's the weight of like, what is this? Is this because of the MS? Is it because of the muscle condition, or is this something new? And just really struggling with trying to take care of my mental health when there's so much going on and new symptoms seem to scare me a little bit. So, how have I maneuvered that? I think just trying to not let it overwhelm me, of just taking time out of my day to rest and relax and do something like play a game on my phone or scroll endlessly on TikTok, and things that kind of can just take my brain away from the symptoms for a while. So, how about you?
Very similar to your answer. We have just so much going on with, you previously mentioned that, my mother-in-law was recently diagnosed with Alzheimer's, so we're maneuvering through all of that, and plus other things going on that I am definitely feeling very overwhelmed. I took a couple bad falls this past weekend too, so my lower back is a little sore, and so I'm trying not to, I dealt for so many months and so much pain just a few months ago, that I'm trying not to get myself too anxious at the thought of, oh my gosh, did I just mess up my back and I'm going to be dealing with months of this pain again? And is it going to get better, or is it going to start getting worse? Because the last time it happened, I was like, oh, it's not so bad, just in a couple of days, and then suddenly things started getting worse rather than better. So that is, I just feel like the last few weeks I've had this huge ball of anxiety in the pit of my stomach, with just too much, because I'm so many people are leaning on me for other things, and I'm feeling like there's got to be a give somewhere. Um, so for me, very similar also with how I'm managing it is just making sure every day I take time to do something that's not focusing on supporting somebody else.
Hmm.
Go out
Okay.
for a hike, play a video game, go have lunch with friends or something like that. But it's hard. It's hard to do. It's hard to push yourself there when you feel like there's so much things you're trying to maneuver through that it's like you could fall into that trap of going, okay, there's too much going on. I don't have time to give myself time off.
Hmm. Yeah.
So
Yeah.
it can be hard to maneuver, but I've been doing my best, just making sure that I'm still taking some time. And if it just seems to start being too much, that's when I set everything aside and I something as simple as just going out and sitting on my deck if it's not 500 degrees outside
Hmm.
too.
Yeah.
Um,
Yeah. Gotta love the weather. I hate the hot weather, but
oh, it's just
um,
been, yeah, there's just been no relief here. It's awful.
yeah. Yeah. And for people with MS
Mm,
or other conditions with heat tolerance,
yeah.
it's even more challenging. So I'm glad we're both taking steps to try and manage the rough road. So that's really good. We need to keep doing that. So, well, we're here to talk about who's really in charge of your health. So set the stage for that. What do you think it really means to be in charge of your health?
My opinion, I feel that we all need to be active participants in our own healthcare. And I think people over the years the shift is starting to happen where people do advocate for themselves or they have loved ones that will advocate for them, versus, even just 20 years ago, a lot of people, or, with our parents' mindsets of, well, they're the doctors, they're the professionals, they know what they're doing, versus saying, no, I don't necessarily agree with this, or I want more tests, or I want, we need to explore this more.
Well, I think it's just a completely different world than it was back then, and the role of chronic illness being so much bigger than it was back then, and the different types of medical testing that they have available. But sometimes it can feel overwhelming of like, wait a second, this is my body, this is my illness, but the doctors are telling me this, the insurance company is telling me this, and it can get really confusing. I have MS, and when I have a relapse, the normal treatment is rounds of steroids, but I'm also a type 1 diabetic. And they put my first relapse, I went into the hospital and they did IV steroids for like 3 or 4 days. And I felt really good in the hospital and got home. And all of a sudden, my blood sugars, I could not get them below like 300. I was getting horrible symptoms with my stomach. It would feel like when you're getting sick, kind of that squeeze in your belly that makes, and it was constant. And having horrible stomach issues. I ended up having pancreatitis from the steroids. So my doctor said, well, there's only one other way to treat a relapse, and that's with an injection. That's a gel you do for 5 days, and it helps the relapse. And the problem is that it cost, I think, $100,000 for a 5 day vial of the treatment, and insurance companies rarely cover it. And a couple of years ago, my insurance company did cover it, but recently, I think it was earlier this year, my insurance company just kept denying it, and the doctor had to keep going back and appeal and appeal. And they finally just said, well, I guess you're just going to have to write out the relapses, which if you don't give treatment to a relapse, it's going to take longer to get through. It could leave everlasting symptoms. And that was frustrating for me because I had a record that the normal treatment was not doable. And this was my only hope to be able to get through relapses. So I didn't like the fact that they were telling me this treatment's available, but unless you have $100,000, this is something that you can't have. Have you experienced anything like that?
Nothing as major as that, but I do remember I've switched insurances since then and have not ran into any problems. But um, I did have one insurance company push back and say, no, we're not going to authorize a PET scan for your checkup this time. You're going to have to go with the less expensive CT scan, which was pretty anxiety inducing because it's like the
Hmm.
PET scan is more accurate, and it's like, well, what if they miss? Because at that point it was pretty early on um with the when I was first diagnosed on that, so I was still a little nervous. That was the only time that really happened. I didn't have any other issues with receiving treatments or anything like that.
Yeah. Yeah. And I think I don't want to spend the whole time on insurance companies, but I know there's a setup with like injuries and things like that to where I've had a bad shoulder, I'm gonna have knee surgery coming up in a few weeks of like the protocol of when things will get covered and what steps you have to do. So like with my knee or my shoulder, your first round is physical therapy, and you have to do a certain amount of weeks of physical therapy. You can do an x-ray right at the beginning, but you can't do anything more. You do the physical therapy and then you are awarded, I guess, with a CT or MRI. And then so it's like a this waiting game of I have to do X, Y, and Z before I can even find out. Like with my knee, the X-ray didn't show a lot. And so then I had to go through weeks of physical therapy to where then my insurance would cover an MRI. And that's where you really find the issues. And so it's a little
Mhm.
frustrating when you're hurting and you've got to follow kind of their plan on getting treatment and getting to the answer quicker. And I think a lot of people with chronic illness, you hear all these stories about it's taking forever. It's taking forever to get to the diagnosis. And sometimes that can just be because you have to complete certain steps to almost like
Yeah.
prove you deserve to have the MRI or the gastric emptying study or the other things that you need to get to your diagnosis.
Yeah. Yeah. Um, now that you mentioned that with the physical therapy and everything, I did go through that too in 2016 when I needed my knee surgery, that I had to do physical therapy before they would even do any kind of imaging other than x-ray. They did x-rays, but
Yeah.
any further imaging on anything, I had to do, I think, like 4 weeks of PT or something before they would even consider it.
Yeah. And if you've got something like a tear or something pretty major, you know, sometimes you have to wonder if the physical therapy is going to make it worse. And
Right. Yeah.
so,
And that
you
was,
know,
yep, yep. And that was the situation with mine. I remember the physical therapist basically saying, you're not getting better. Like, this is not getting better. This is actually getting slightly worse. This is an injury. Like, this is a tear,
hmm,
not just an injury that PT is going to help. So,
yeah,
and then you get the surgery and then you turn around and have to go through more PT after your
yeah,
surgery. So,
yeah, yeah, which that makes sense. But, and my doctor even said, you've got a meniscus tear, PT's not going to help. And that was after I already went through PT and so it just basically delayed the inevitable. So, In doctor's appointments, do you feel like doctors have enough time to really hear our concerns and questions?
I feel that the medical profession are just so overworked that it's not, in general, I don't feel like it's intentional. If you feel that your doctors, I mean, I definitely have noticed a difference over the years with our general practitioner and the amount of time they're willing to spend with each patient. Where before you used to be able to go, 10, 15 years ago, we could go in for one thing and be like, oh, hey, you know what? I forgot that I've been dealing with this and talk about two things. And now they're like, this is what your appointment is for. If you want to talk about anything else, you need another appointment because we don't have the time to spend. Um, and so to me, I can't help but wonder if, and we've talked on previous about how tracking your symptoms, and not just tracking your symptoms, but your blood work, because they don't have the ability and the time to do that.
Hmm.
They just look for those red flags that pop up on the reports. They don't necessarily have the ability to look at how your personal labs track. So
Hmm.
I but I do feel that we still have that. A lot of people are like, well, the doctors know better, or you just walk away frustrated because you think that a lot of times you're waiting for an appointment for weeks with a specialist, or months, and
Hmm.
then you walk out with no answers. Can be frustrating.
Hmm.
um but that's where the importance of you being an active participant in your care,
Yeah.
of just pushing back and going, okay, well, if we can't talk about this now, can I schedule like a longer appointment? How do I go about scheduling a half an hour appointment versus a 15-minute appointment so we have more time to talk? Or
Hmm.
it's hard.
Yeah. It is just a whole nother beast. I think with the increase in chronic illness cases, as well as healthcare just being overwhelmed with things, I think everything's just more difficult. I mean, even getting to a specialist sometimes requires you to make an appointment with your regular family physician just
Mhm.
to even get a referral to see the doctor. And then you're waiting so many months to get that taken care of. I know we've talked about that, but it's just, I think it's difficult to take the 15 minutes that you get with this healthcare professional and try and get all of your questions answered, and get them to really understand the effect that it's having on you, and trying to get all that information done in a short amount of time. There's been times where I've gone to an appointment and I've been rushed off to where I left with questions, and
Mhm.
it really shouldn't be like that. It really
Yeah.
should be more of a conversation of, what did you come here? What questions do you have? I love when my doctor says, what questions do you have? Because that
Hmm.
opens up the
Hmm.
conversation. They want to know what I think.
Yeah. 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 Versus this is what we're seeing. Chat, schedule your next appointment on your way out, type
Yeah.
thing,
Yeah. And I
which
think,
can happen a lot.
yeah. I mean, we have to talk a little bit more about advocation,
Hmm.
advocating for yourself, because I think sometimes patients who advocate strongly for themselves can kind of be labeled as difficult. And I wonder if
Yeah.
doctors feel like, oh, oh, it's Rachel's appointment. She's going to push back on everything. She's going to ask for these tests that I know she does. I don't think she needs, or whatever that might be. And I think that can be
Right.
hard for people to really feel like they're standing up and trying to get the care that they feel like they need.
Yeah. Yeah, I agree. It's definitely, the doctor already has a certain mindset at that point before the appointment, which can make it difficult to work together.
Mhm. Are you living with pain? We get it. And we're done pretending it's just a part of life.
That's why we use the universal heat patch from Spicy. Natural, clean heat, no meds, no mess.
It sticks on discreetly, moves with you, and gives you up to 12 hours of relief. No cords, no chemicals, just actual comfort.
Created by people who live with pain for people who live with pain. Finally.
Grab yours at getspicy.com. That's GETSPICEY.com. And follow Get Spicy for real talk and real tools.
Spicy, because you deserve relief that works.
And thanks to Spicy for giving our listeners 10% off when you use the code SPOONFUL. That's spoonful with 2 L's at getspicy.com. Well, I think sometimes what's missing in the patient doctor relationship is really taking into account the effect that the symptoms or the disease is having. Sometimes it's completely based on test results, and when you really look at the fact of I can't do this anymore. I can't take care of this. I can't clean my bathtub because of a fall risk. I can't, and
Mhm.
and really communicating how it's impacting your life. I think that part is important, but I wonder just how much they really take into account the daily effect of what you're dealing with, you know?
Yeah. Sometimes it's easy to feel like you're just a statistic. You're just
Another
whatever they
patient.
see on the paper. They see what, yeah, yeah.
Mm-hmm.
They see the chart, and you're just a chart for them versus an actual person. So sharing that this is how it's impacting me on a daily basis makes you human.
Mm-hmm. And and I know we certainly aren't putting all doctors in one pile. I
Right.
have a few doctors in my team that that I can say, this is really, really having a hard time, and they take that into consideration. I think I have some doctors on my team that don't do that. And if I get to the point where I feel like they're ignoring my care, then I have to make that decision to move forward and get a second opinion or find a practitioner. And I have done that. That's how I got my muscle
Mm-hmm.
disease diagnosis. But I think it's just about reclaiming your role in your own medical care. Obviously, you've got the doctors, the professionals, but making sure that you've got kind of your fingers in everything. You've got kind of your nose sniffing at everything and looking at the whole picture and just reclaiming that, this is I'm in charge of my own healthcare, and the doctors, as much as you can, the doctors can give you advice, and you can try and help by getting the test that you need. But obviously, we've talked about roadblocks with that and everything. But there is definitely a point where you really have to step up and be in charge of your own care.
Right, right. And how do you push back? And also, and like you just mentioned, if you don't feel like your doctor is supporting you, it's okay to go get another opinion. It's okay to switch doctors. But when you're looking at specialists,
Mm-hmm.
that may not always be an easy thing, especially, in a field that there may not be a lot of options in your area. So, um, It may not be as simple as, oh, I'm gonna try to find another one that can support me if they're the only one in town. So that's finding the best way to advocate for yourself with the team that you have. Maybe the only, that may be your only option depending on where you're at.
Yeah.
So,
And it's never quick. I mean, when I reached out to a different neurologist, I didn't want a neurologist in the same practice. There's like 20 neurologists in the practice. I had to go elsewhere to a different hospital. I had to go back to my family doctor and request a referral elsewhere so that that didn't kind of get in the way of my care for my MS, and it can be difficult, and it took 6 months at least for me to from the time that I got the referral to the time that I got to see the doctor and completed the test he wanted me to complete, and about 9 months to diagnosis. So it's definitely not an easy course, but if if you're being ignored, then you have to take back the power
right.
of your life. So
Mhm.
I think we can't end this episode without talking about, some tips for taking charge of your health. What are some
Right.
tips that you can give for kind of being the CEO of your healthcare, of your
Of
of
your
your
healthcare.
care? Hmm.
Right. Well, one of them, a big one for me anyway, is because if you don't feel like you can advocate for yourself, if it's just that's not you, find somebody, bring a family member, bring a close friend, bring somebody that can be your advocate.
Hmm. Yeah. Yeah, that's really important. Um,
Because I know me, I'm one that I'll go in and be like, okay, I am going to advocate for myself. And then as soon as I ask the question and want to, for something I'm wanting, or can we test for this, or can we do this? If they say no, I don't think it's warranted, I'll be like, okay. And I take that in. I
mhm.
don't push. So,
Yeah.
um,
And it can be
um,
as simple as just saying, I understand that you don't think this test is that I don't need this test, but I'm still experiencing these symptoms. So what can you do to either find out why these symptoms are happening or help me with these symptoms? Even something as simple as that can be a way to kind of advocate. I tend to sometimes, if there's a question about coverage or whether or not a test can be done, I always seem to go to my doctors and be like, well, can we do this and can we do that? And I've started pulling up my app for my insurance and really looking at the benefits of the healthcare and reaching out to my insurance company to ask, why is this not covered? What do I need to do to be able to get this covered? And really understanding your insurance plan, finding out what's in network, what's out of network. If something has been denied, appeal it. And those are all things that are in place that I don't think, at least I don't take advantage of as much as I should.
mhm. Yeah, that's important. And also, do you feel, as we talked about, the how it seems the medical field is just so overwhelmed, um, doing that research might help, being able to walk into the office and say, okay, I've already looked into this,
Hmm.
and to make your case may also help your doctor being a little more on board because then you've got the knowledge there. I mean, that's, yeah, I don't know if I'm saying what
Um,
I'm wanting to
no,
say correctly.
I think that I'm very lucky right now that we have good insurance and they tend to cover more than what my previous insurances has been. And so I think sometimes doctors might make a decision based on like the average insurance, and maybe if you have really good insurance, they may cover something that most insurances don't. So I think if you said, my insurance will cover this as long as I meet this criteria, or um, my insurance will cover it if I've been experiencing pain for this long, or whatever that might be, or they're not covering this drug, but I found similar ones that they will cover. And being able to go in, I mean, knowledge is power. So if we have that information, it can definitely make a difference in your plan of care. And that's again where if you're in charge, you should know kind of everything, all of your options and everything going forward.
Funny though, because now, like looking back when I was like, oh, I've only ever had this with my CT scan, I remember now the situation with, remember when I was going through the colitis that was being caused by
Mm-hmm.
Keytruda, but my oncologist kept insisting that it wasn't the Keytruda, so she wouldn't put me on the steroids I kept asking for.
Mm-hmm.
It's just the importance of not just advocating for yourself, but coming to the realization that you're the driver
Mm-hmm.
you're the driver in your healthcare, and all your doctors are your pit crew essentially.
Right. Right. It's easy to feel like they know more about your illness. And it's easy to fall into that trap of trusting your doctors and that they have the best intentions. And most of them do, but
Mhm.
arming yourself with the power of knowing your test results, knowing, um, what the daily life with your illness is, and being able to walk into that appointment and they know that you're in control of of your body and of the healthcare. So ultimately, we are the ones that have to take back control and protect ourselves. So it's hard to do, but it definitely is important.
Yeah, which also is
Um,
another, it can be kind of hard to do when you're like, sometimes you just get tired as a chronic illness warrior. You just get tired of being strong all the time. You get tired of having to be the one that's in control. And you just like, for me, I just want to walk into my doctor's office and be like, just tell me the magic words of it. You know what I mean?
yeah.
Um,
Unfortunately, I don't think in this era, I just don't think that that's, I mean, I'm sure
you
that you
can't,
could, but I
yeah,
think it's just a completely different world with healthcare and just the amount of people that are dealing with chronic illness and this
that they're saying,
mysterious chronic illnesses
yeah,
and all of that. So,
yeah,
take what
yeah.
you want from what we've said, and we're going to ask our Instagram page for feedback on how they maneuver through their medical care. So, well, let's get to Claire. Excited to talk to her. Claire is a 42-year-old dog mom, proud fiance, and lover of Lady Gaga and leopard print. And I'm hoping she comes in leopard print. So, but after years of unexplained symptoms, she was diagnosed with vestibular migraine in 2023, hemiplegic migraine in 2024. Claire's passionate about raising awareness, breaking the stigma of migraines, and showing that migraines are never just a headache. So let's go ahead and bring her in. Welcome, Claire, to the podcast. We're really happy that you decided to come on and talk about your journey with migraines. So, first, we would like for you just to introduce yourself to our listeners. Just tell us a little bit about you.
Okay, my name's Claire. I'm in Nottinghamshire in the UK. I've actually used to work in pharmaceuticals, which I find really interesting now because there's drugs now that we were working on 10, 15 years ago, and actually one of my
Mm.
migraine drugs is by the one of the companies, and I think, oh, maybe my clients are still were developing this, so that was really interesting as well. But Um, yeah, I've studied a lot in my life, and I love my classic Mini. So I drive a 40-year-old Mini, which is a little bit different. You're not very inconspicuous in it, and yeah, not that I'm driving much at the moment, but yes, just a few little things about me there.
So let's start at the very beginning of your symptoms. What were your first symptoms? How did they feel? How did they present themselves?
Okay, so this started in September 2020, and it was just really bad nausea and unexplained regular vomiting. By January 21, I was waking up nauseated. Um, and it sort of went on from there. And as you would imagine, if you present to a doctor with nausea and vomiting, they're going to look at your gastro stuff, they're going to look at your stomach and your digestion, etc. So that was the route they went down. And obviously, as we all know, oh, your tests look normal repeatedly.
Mhm.
And then it actually wasn't until April 2023 when it was my mum, and she said, well, your auntie's got Meniere's. And I wonder if that's something that's going on because we just can't explain this from a gastro point of view, and you're still symptomatic. And my symptoms had then developed into brain fog, dizziness, vertigo, problems with speech, and things like that. So we went to see an ENT, and he sort of said, well, it's unlikely because you're struggling for a long time, your episodes, as it were, are far too long to be Meniere's. But here's the details for a neurologist that I really recommend. And within the appointment, that neurologist went, yes, migraine, just like that, straight off the bat. I remember crying coming out of the hospital, and
Mhm.
one of the nurses saying, is everything okay? And I was like, they're happy tears. Um,
Mhm.
so yeah, since August 23, it's been just now knowing what's going on. Is just throwing as much as we can at it, learning more about it, connecting with more people. Um, I think for anyone, it's just so important to know what you're dealing with. And I think people with invisible illnesses, it just takes so long. And in that time, you're almost trying to prove that there's something wrong with you.
Mhm.
People just can't understand it until they actually see something that's particularly unpleasant or whatever. So, and finally to have someone listen to you. I'm really fortunate. I've never been gaslit, whereas I've got like a lot of people I'm connected to over my Instagram and things, and one of my close friends. It's just been absolutely ridiculous when her test results haven't come back normal. um, and she's been told it's X, Y, and Z, and it just doesn't add up. So yeah, I've been really fortunate in that respect.
Mhm. Now, you were diagnosed in 2023 with vestibular migraine, and then
Yes.
in 2024, hemiplegic migraine. So, can you tell us the difference between the vestibular migraine and the hemiplegic migraine?
Yes, certainly. So I think also I just want to say I'm again really fortunate in that from the 2020, and it was actually only started in August 24 is August 24 was the very first time I experienced pain. Yeah, so and again I think that was difficult within the diagnosis because I didn't have pain. And since August 24, I'd say maybe 15 times I've had pain. So again, really fortunate, but it makes it more confusing. But vestibular migraine is it's the dizziness, it's the vertigo. It typically comes more with the nausea and vomiting, which is where it went. It can last from about 3 hours to 72 hours. So yeah, it's very debilitating in that sense because again, not that many people present with pain. Um, and yeah, it's very much focused on your just ability to interpret what's going around you. And obviously, most people experience different types of vertigo as well. So mine's a little bit different from typical. But yeah, that's the main presentation of vestibular. And you have a test as well, which determines that it's not your vestibular system in your ears. So it's not an inner ear ENT issue because they can tell that it's your brain telling your balance system to go wrong. So that's kind of the most definitive test for that. And hemiplegic migraine essentially presents like a stroke. You really struggle with speech, you struggle with vision, and you'll have complete weakness and paralysis on one side of your body. Um, this happened to me. It was last July, and I went into hospital. And again, obviously, they're testing like, oh, well, your CT, your MRI. We're looking for a stroke or an aneurysm or something really acute that's going to be a long time recovering from. And I was really fortunate that that was fine. And because I had this weakness and things, it came out as hemiplegic. So the combination of the two is incredibly challenging, and sometimes it's what's which one is this right now? Like, what is happening? It's so difficult to determine. And like you were saying, everyone's kind of like, we all assume that it was headache. One of the reasons why we were, when myself and my fiance were like looking into it and thinking, what on earth's wrong with me? Well, she doesn't have a headache, can't be anything neurological. That would be crazy thoughts. But yeah, and I think we've learned so much about different symptoms. The two that I really struggle with, which I would never ever think were anything to do with migraine, is sinus congestion. So be it, all blocked or runny nose and horrible things like that. And also going to the toilet a lot in terms of frequent urination. Oh my word, it's just so disruptive. It's one of the most irritating things. You kind of have to laugh about it. Like when I'm with my friends, I was like, "Oh, sorry, I've got the migraine wheeze," so people understand that it's not. I'm not just. I'm not avoiding them. Um, I just. I'm struggling with that. So yeah, that's really the distinction. I mean, hemiplegic is very clear. You've got. It's essentially you're paralyzed down one side of your body, and as soon as they rule out stroke, that's your next. Your next port of call. When things don't show up on scans, etc. So yeah.
Join Spoonful of Strength on Instagram, a community open to everyone. Whether you have a chronic illness or support someone who does, you are welcome at Spoonful of Strength. You'll get preview clips of the upcoming episodes and insight into my world as a spoonie. That's Spoonful of Strength, spoonful with 2 L's, on Instagram.
When it flares up, when you have episodes, is it usually one or the other, or do they kind of combine together at the same time?
I think, yeah, that's a really good question. I think they're in themselves, they're quite distinctive, but I would say like the aura can be very similar. So, sort of vision and struggling with word, I slur my words sometimes. That's presented in both, and tingling, lots of tingling across my body and things. So, and then it kind of goes one way or the other. Vestibular is I've suffered much more with vestibular, again, fortunate because hemiplegic is particularly unpleasant. So yeah, it's more the auras can be similar.
Have you found any daily comforts or routines that help ground you when you're having a migraine or when things are kind of flaring up? What are the things that you do to kind of calm that noise?
Yeah, I think that's one of all of our challenges, isn't it? I've learned recently, I was always terrible for it. Just go and rest, Claire. Just go and lie down. Take yourself out of this. If yourself or like my fiance can get me safely in a space, nothing bad can happen in that safe space. So I think that's been a really big thing, and just resting, just really acknowledging that your body is telling you something. So I think that's something that I constantly remind myself, and I've got an awful lot better at that now. And I think it's one of those things where you think, well, this at the time you're like, oh, this is the end of the world. But you come out at some point. You're still, you're still exhibiting symptoms and things, but you do come out, even if it's only a little bit come down. It does, you do get some of that relief. And I think one of the most important things is, and this again, there's only recent, and this is my fiance really pushing this matter, of what have you achieved today? What's made you happy today? And every day just thinking, well, what made this, what was a good thing, even if it's a tiny, tiny thing, so we can all remember like this. It's not bleak. It's not the end of the world. We are still trying to do, and even if that is, I've acknowledged I need to rest, and I've taken myself to bed. I think that's something to, to be happy about because you're actually looking after yourself. So I do think, yeah, celebrating like even if it's a teeny tiny one, just your achievements for the day.
I love that question.
Yeah. Yeah,
I
that is
love that
great.
question.
I
Yeah.
imagine that.
That's one of
I
those
imagine.
questions that, how people write things on their mirror. That's definitely a bathroom mirror question to put on there to ask yourself every day at the end of the day. So we love how you describe yourself as Lady Gaga and a leopard print lover. Just a fun, like that just gives this persona of like just such a fun, positive person. How have you kept hold of your identity and sense of joy through this whole process?
Um, I think it's a really good question. I think in terms of, you do I've felt that I have really latched onto those two like big loves of mine. And for example, on my Instagram, I'm leopards, so I was just like, well, that always reminds me I've got migraine, which is not less than ideal, and then something that I really love and put it together. And obviously there's a lot of different spoonies with, like the is it EDS is the zebras and things, so it kind of fits in there, and it just makes me really happy that I'm getting to include that in this side of things. I mean, I never, if I do leave the house, I never leave the house without something leopard print on, and as we've all been there when we've got our jogging bottom or sweatpants, our jogging bottoms and our comfy clothes. Mine are predominantly leopard print. And I think again, it's just about celebrating your like don't forget what you love. Don't let it, don't let it fall by the wayside. Continue to engage with it, to continue to think about it. One of my other loves is horror films, which a lot of people are horrified by, but those are my comfort things because well, some of them I've watched a million times, and that's just part of me. And again, it's something that I can just go, I'm holding on to this. This is part of my identity. These hobbies, loves, sources of enjoyment have remained with me. And we all know that there's those days when everything is just, you can't, it's just horrible and you don't even think about those things. But then you can pick it up ever so slightly. Like for me, oh gosh, I'm having a terrible day, but I'll put a horror film on because that's me.
Mm,
And I've always been
mhm.
that. And this is just something that I'm having to deal with in the meantime. Yeah.
Hmm. Well, I'm a big dog lover too, so I have to, number one, know what kind of dog you have, but also, how do your dog and your fiance support you during your chronic illness?
Should we start with the dog?
Yes, yes.
Um, so he's a miniature pincher. So he looks like a Doberman that's shrunk in the wash.
Oh my Lord. Oh
Is
my
that was how
goodness.
I describe him. Like he's 10
Yeah.
inches tall, he's about less than 4 kilos. He's 9 years old now. And they give you so much joy, don't they? Um,
Yeah, yeah.
and they're just their own little characters. And again, with me, it's that thing. Well, I'm having a really bad day, but he makes me feel better. And I'm absolutely convinced he's quite a sensitive dog, and I'm absolutely convinced he knows when I'm not particularly well. I really
Mm,
am. He'll come up and he'll sit on my lap, and he's actually sat on my lap. And my fiance's like, he's licking your weak side, like as if he's trying to nurse me. I might be reading
mm.
far too much into that, but that's how it
Oh
makes me feel.
no.
Yeah, and he's he's a responsibility, and sometimes you feel like you've lost the ability to be responsible for your pets, and so then walks become even more of achievements. Last year when I was particularly unwell, I think I walked. There was a walk in the beginning of August, and I hadn't walked him on my own since the end of June. And the independence that gave me, and knowing I could keep myself and him safe, because that's a lot of the time when I'm like, I'm not going to be able to keep him safe on my own, so I need someone to come with me. And I think that again, that's purpose, isn't it? You're looking after another little
Yeah.
life. So that's important. And then my fiance, bless him, we we've been together, it'll be 4 years this year. So he's seen pretty much all of this. And he's been incredible. There's been such, like I said earlier, he makes sure I'm safe in bed. He'll get me my drinks and things because there's been occasions when, he's had to hold my drinks so I can sip them, get a straw. He's he's had to take me to the toilet, undress me, dress me, wash me, all those kind of things. But also one of the things that he, and he does get credit for this, but he's very happy about it, is when this was all going on, when we kind of started thinking it was neurological, certainly with the vestibular and that link to Meniere's, he was like Googling and he went, well, maybe it's
Mhm.
vestibular migraine. And then when I was in hospital last year with my vision and my weakness, well, there's such a thing called hemiplegic migraine, and that's what I left the hospital with. So he's very happy that he came up with those. So he's really supportive in terms of doing his homework and then making me feel better
Yeah.
because he's like, oh, don't worry, but that is a thing. You're not,
Mhm.
that is a migraine thing.
Yeah.
So yeah, he's, drives me round and all sorts of things. He couldn't be any more supportive and understanding. Yeah,
Oh,
100%. Mm.
That's
that's
wonderful.
awesome.
Having a strong support system is so important to maneuver through everything. What do you think needs to change in conversations around invisible illnesses like migraines?
Um, I think it's just you see it all the time. Like this is a disabled person and this is a disabled person, and the dismissal. And I don't know how we're going to get over that. I think it's just got to be, we've just got to keep showing what it is, demonstrating what it is. And that's why there's so many people in like the Spoonie community all trying to do that job. And I think a lot of the time as well, we need, we almost need like literature about it. And how we can communicate it in the best possible way. Um, I've said to people, well, I don't know you've got a cold right now because it's not visible that you've got a cold, or you haven't got, you've got tonsillitis. I can't tell if you've got tonsillitis, but you're sick, right? So it's kind of trying to put it into a more real life situation for people who don't have chronic illness. I think that's as much as you can. And getting all your advocates, all your support system to be communicating that as well. Um, I think from a medical point of view, as when I saw my neurologist, he said, well, our National Health Service, when they were going down the gastro route and when they thought it was a brain lesion or a brain tumor, he said they made sure that essentially you weren't dying. And that's a good thing, even though it was a really convoluted, drawn out process. They did do their job, but you needed
Hmm.
someone like me to deal with it. But I don't know if we're ever going to get an answer, quite frankly. But I do think the more conversation that we have, the better. Not to shame people for talking about things, oh, you're just doing it for attention. No, this is my life, and I need you to understand. So, yeah, it's a really tough one, that.
Yeah. And I think some people, when they think of migraines, they think it's a headache. And oh yeah,
Mhm.
I have headaches a lot, you know.
Yeah.
So what's the one thing that you wish people understood about migraines that make it different from just a headache?
I think that's the thing. I think you see it, well, certainly on my feeds and things, people documenting, whether that's from an official source,
Mm,
like the Migraine Trust that we have in the UK, of all these things can be that. And one of the first things I say when people get headache, when someone says, well, I get headaches too, well, I don't actually really get
mm,
headaches. But I'm diagnosed with two types of migraine. And oh, well, how is that? I said, because not all of them present with headache.
mm.
And just try and make people go, and people do go, oh, never knew that. Yeah. So I'm telling you, and I'll tell them, this is what happens to me. So yeah, that's the main thing. I say, well, I don't really get them.
I love
Mhm.
that. Mhm.
Mhm. Yeah. I mean, honestly, until we started this chat with you, every time I think somebody says they suffer from migraines, I immediately think of the headaches, like the migraine headache part that I deal with. So I had no idea that that wasn't that there was other like so many other symptoms that I knew there were other symptoms, but I didn't realize that headache is honestly, is it fair to say that headache isn't necessarily the main
Yes.
symptoms for a migraine disorder?
I would say it's not necessarily. Um,
Mhm.
I have to say though, the people I do know who suffer with the pain, I don't know how I struggle sometimes, but that constant searing pain, I can't begin to imagine how difficult that must be. And you know, if someone was, if someone said to them, you know, oh well, I get headaches too, and it'd be like, well, do you end up in bed? Do you end up needing someone to
Right.
care for you? Have you had to take time off work, etc., etc.? You know, it's not just a headache. It's it's a neurological disease that is
Right.
manifesting in all these different ways.
Earlier in the podcast, Tina and I discussed a question of who's really in charge of your medical care and looking at some of the roadblocks that we encounter. And so I wanted to ask you, have you ever had to change doctors or maybe even just challenge a medical decision in order to kind of take back control of your health?
Um, yes, there have been some stern letters sent to a variety of different people, organizations, in terms of just it's really tough because I don't feel like I was ignored or gaslit, but it was just it was taking so long for anybody to rule things out. I think that was
Hmm.
difficult, but I would I we wrote letters and things, and just kind of took ownership and said, look, this is instead of those conversations you have in hospital, these are the facts. And not only are these the facts, this is how it makes me feel. My quality of life is compromised. I can't do X, Y, and Z. And I need someone to listen to me or give me an indication of what do we do next. Because there's a lot of that as well. This sort of, you know, scratch the head and things like that. So I think that's something you're advocating for yourself and back your facts up with
Mhm.
how it makes you feel and take ownership.
So important. And I like how you, with writing letters, because I know me personally, in the moment, I don't, I don't like confrontation. I don't question, but it would be for, so for me personally, and probably for many others, it's easier to sit down, go home, write out all those thoughts and shoot it off to the doctor's office
Yeah.
versus trying to advocate if you struggle to advocate for yourself in the moment. I think
Yeah.
that's
Yeah, and I don't necessarily think I did, but I know a lot of awful people. No, awful people. I know an awful lot of people who, yeah, do. And it's the breakthrough that you get. That's the, you know, eventually. Well, I'd like to think eventually everybody gets there, but I think it is the roadblocks for the, you know, a pretend, well, predominantly like your test results are normal. We don't know what's going on, etc. So you go, well, do you know what? This is what's going on. I'm going to give you kind of like the qualitative data to your quantitative data that's telling us nothing,
Hmm.
because this is my life. And yeah, I think
yeah.
that's the most important thing to take that control because it can get you run away with. And yeah, I see what you mean about like confrontation. You just think, well, they know better than me because they're
Hmm.
yeah, it's yeah.
They're the professionals, you know.
Yeah, and I think
Mm,
sometimes they look at the labs and the x-rays and the CTs and they don't look at how this condition is affecting your daily life and the
The
yeah,
things
person.
that you're giving up
Hmm.
for it and how much it really impacts your life. And
mm,
so, yeah, it can be really hard. It's a good
yeah,
conversation to have. So,
Yeah.
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 You talked about how your diagnosis was kind of a long time to get to the diagnosis. So, if there's somebody out there who's experiencing mysterious symptoms, what's a piece of advice that you would give them? to help get to that diagnosis faster?
I think speak to I think very similar to what I've said just now is, write everything down. Just if it's just, oh, well, I don't know, I had pain on, nerve pain here, or my vision, or a particular type of headache or something. Just keep a record of that and then document all the things that it's kind of cost you. And I think the use of quality of life as a phrase is one of the strongest that we can use. It certainly helped. It helped to get me heard, and just if you've got some symptoms that you don't understand, well, try and connect on social media or support groups or things where it's just like, well, I can't stop doing this, or this keeps happening to me, and just kind of try and do a little bit of a deep dive as much as you can with the information you've got. I think that's important. And yeah, I would just say the most important person in this scenario is you. And it's
Mhm.
how you feel and it's what's happening to you. Don't let anybody else tell you how you are feeling.
Mhm.
I think it's very, because again, you'll lose yourself into questioning yourself and so on. If you've got those
Mhm.
facts and you know how you feel, I'd like to think that you would get more support and understanding and investigation.
Tell our listeners where they can find and follow you on social media.
Yeah, okay, so it's it's the migraine leopard, so it's the underscore migraine underscore leopard on Instagram.
Lots of great content. I've been checking you out and following you, and I love your little snippets and the positive things that you post and really just the memes of what it's like living a daily life with chronic illness. It's a great page to follow.
Thank you.
Yes.
I will just say one more thing, excuse me, is do you know what one of the best things about the Spoonie chronic illness community is? We
What's that?
are in, we're incredibly self-deprecating. We are funny people. We
Yeah.
Yeah.
we communicate through that so much, and I think that is
Hmm.
just I think that's brilliant. I love it. Yeah.
Yeah. I
Yeah.
think you have to. It can't be
You
dark.
have to. Yeah, great. Yeah, because it's so easy to fall into that dark, into the darkness. So, you've got to
Yeah.
inject that light that not very many people, like those that don't suffer, are probably like, "Are you kidding? Like, what the heck? Why are you joking around like that?" And it's like, "Cause you got to."
What else?
Yeah.
Yeah, exactly. Oh,
Yeah.
yeah.
Yeah. There's so many things that are in common. No matter what type of chronic illness you have, you can always find those common grounds.
Yeah,
And
Mm.
that's what I
yeah,
really love about the chronic illness community. So if
yeah.
any listeners out there have not followed Claire, then definitely get onto her Instagram and give her a follow. And we just can't thank you enough for coming on. It's been
Yep.
a really interesting conversation. I think Tina and I both fell into that
Hmm.
migraine is kind of a one scenario and didn't realize there were so many
Right.
different types
So
of
many.
migraines and the different symptoms that it creates. So we thank you for giving our listeners a little insight to your life.
Oh, lovely. Thank you ever so much for having me. I really enjoyed it. Thank you.
Great. That was so informative. Like going in, like I had mentioned throughout the interview, when I think migraines, I think, the aura, the pain in the eyes, the severe headache, sitting in a dark room because you're light sensitive. I
Hmm.
had no idea of so many other symptoms. So I'm so glad that she joined us.
And to realize that headache isn't necessarily the main symptom for her. I knew there was a correlation between headaches and like neurological things, but I didn't realize that you could
Hmm.
have that happen without, I mean, how scary is it to feel like you're having a stroke and it's a
Right.
migraine? That's,
And it's a
you know,
migraine. Yeah.
yeah.
Yeah. Because
And
that's got to be hard because I've never had a stroke, thank goodness, but that in itself is terrifying. But to know that you could repeatedly have those similar symptoms based on the migraine disorder, I would have a really difficult time adjusting to that.
And there was a couple things that she said that I actually wrote down. She said something about documenting to the doctor what it has cost you. And I love the phrase of that, of not like, this is what I'm dealing with or whatever, but this is what it cost me, these symptoms. This is what this illness is costing me. I think is just a brilliant way of putting that to the doctor, of really realizing, this is impacting my life in this way. I just loved that. And another thing that Claire had mentioned was the most important person in this whole scenario is you. And I love that because we really have to be our own advocates. And I think that's really important. This has been a great episode. We are looking forward to bringing you more episodes this season. And make sure and take time to take care of yourself this next week. And remember, you're not selfish for putting your health first. You're wise. So until next time, for Spoonful of Strength, take care. Thanks for tuning in to this episode of Spoonful of Strength. We hope that you found a little inspiration and maybe even a new perspective to carry with you.
If you enjoyed today's episode, don't forget to hit that like button, follow us for more, and leave a comment. We'd love to hear your thoughts.
And if you're feeling generous, please take a moment to rate and review the podcast. Your support helps us reach more Spoonies just like you.
Until next time, remember to take care of yourself and keep finding strength in your story. Bye for now.
And see you next time on Spoonful of Strength.